5 of my favorite thyroid supplements. I'm naturopathic Dr. Emily Lipinski. I have Hashimoto's hypothyroidism myself. When I was first diagnosed with thyroid problems, I was told by my doctor that there was nothing I could do except take thyroid medication. And when I took the thyroid medication, my thyroid symptoms still persisted. My labs looked better, my TSH normalized, but I was still always feeling cold. I was always tired. My puffy face was still there. And I also still had the weight gain. So after years of research and changing my diet and lifestyle and using some specific supplements, I no longer have these super frustrating thyroid symptoms. So these are 5 of the most common thyroid supplements I use with my patients. This is not medical advice. You have to check with your doctor or healthcare provider if these supplements may be right for you. It's also really important to note that because these supplements improve thyroid health or may improve thyroid health, sometimes individuals that are using medication require a change in medication after they use supplements to improve thyroid function. Number 1 is the use of vitamin D. Individuals that have low levels of vitamin D are at an increased risk of the development of Hashimoto's hypothyroidism. Hashimoto's hypothyroidism is the most common reason for hypothyroidism. It's not the only reason, but by far it's the most common. It's an autoimmune disease. For my patients that come to me, I'm always checking if they have Hashimoto's. It gives us so much insight on how to treat the thyroid, how to improve thyroid symptoms. And one thing we always check is vitamin D. The other thing is the use of vitamin D in the studies show that individuals that are vitamin D deficient and they improve their vitamin D levels may help to improve thyroid symptoms, and it also may help to improve TSH. Number 2 is vitamin B12. Like vitamin D, there is an increased chance that individuals that have Hashimoto's hypothyroidism have a lower level of vitamin B12. And optimizing vitamin B12 can improve symptoms of fatigue, can also help with cognitive function. And this is also really common in my patients with hypothyroidism. They report foggy thinking or trouble with memory. That may be partly to do with the thyroid. It also may be partly to do with the fact that they could be vitamin D deficient. So I'm checking both vitamin D and B12 and supplementing to optimize those to help improve thyroid symptoms and to also potentially help to improve thyroid function. Number 3 is selenium. Selenium is a nutrient that can help to improve the thyroid function. The thyroid requires selenium to make proper thyroid hormones. It can also help to potentially lower thyroid antibodies, and it helps to improve the conversion of T4 to T3. T3 is the active thyroid hormone. I have a lot of patients ask, can I just get my selenium from Brazil nuts? And this could be possible. In patients, however, that have very high thyroid antibodies, very severe thyroid symptoms, I am going to use the supplemental form to ensure that we are getting the correct dose and that they are getting enough selenium every day. That's reflective of what the research says to potentially lower those thyroid antibodies and improve thyroid function and the conversion of T4 to T3. Number 4 is zinc. Like selenium, zinc can help to improve the conversion of T4 to T3. Zinc may also help to improve immune function. A lot of my patients with hypothyroidism, because they have the autoimmune form of hypothyroidism, they tend to get sick more often. So zinc may be helpful with this. And finally, the use of Commiphora Merkel, which is also very helpful in the conversion of T4 to T3. And for some people, they may notice weight loss with the use of Commiphora and improve thyroid symptoms because it's improving that T3 so much. Commiphora is also commonly used to lower cholesterol levels. And individuals that have had hypothyroidism for a long time, they also may have increased cholesterol in the body because optimal thyroid function is necessary for the metabolism of cholesterol. So Commiphora, I find, is helpful for those individuals that are really looking to lose weight and also may have a slightly elevated cholesterol level. Again, not medical advice. If you're thinking about any of these supplements, talk to your healthcare provider. I outline all these supplements in my book, Healing Your Thyroid Naturally, that's available on Amazon in Canada, US, and other parts of the world. And I'd love to hear your thoughts in the comments below. Have you used natural remedies for thyroid and hormone balancing? Have you found them helpful? Would love to hear from you.